Good
Happy
morning,
morning,
everyone. Can you
Anitha
hear
ma'am.
me?
Yes, ma'am, we can hear you.
Yeah.
You can start with your class, ma'am.
Yeah. Good morning, everyone. Today, my topic of presentation is outcomes of infants born with the ART. We all know, and many people have doubts that whether the children born out of induced conceptions or IVF or ICSI, whether they'll be normal like usual children or they'll be abnormal like more anomalies or more other abnormalities. Many common people, they'll have this suspicion and thinking the children born with the ART will be abnormal. Many won't come forward for the treatment also. So today, over millions of babies worldwide have been born by medical interventions. And in that, almost 1 to 4% of the born children, they are born from the induced conceptions. However, the concerns have been raised about long-term health of the children conceived following the ART. Many studies and meta-analysis have reported an increased risk of birth defects after ART. So why this increased risk of birth defects? It's due to hormonal stimulation, altered oocyte environment, and impact of the embryo culture on fetal development and expression of the imprinted genes. Use of ICSI, that when we are injecting, that it's more invasive than the conventional. So breaking of zona pellucida and cytoplasmic membrane can lead to injuries of the internal structures of the oocyte, which can lead to the abnormalities in the offspring. ICSI also evades natural selection of the sperm at the oocyte membrane, and abnormal genetic materials may be passed to the children. So transferring more than one embryo increases the rate of multiple pregnancies, causing higher neonatal morbidity, which we all know. So evidence suggests that even ART following like singleton pregnancies following ART also are at elevated health risks, not only multiple pregnancy or higher order pregnancies. So risks for the children born after ART, it is under the headings of adverse neonatal outcome, birth defects following ART, chromosomal abnormalities, imprinted genes and epigenetic diseases, increased risk of cancers, adverse neurological outcomes, risk of cardiovascular diseases, physical health, and with respect to psychosocial development. So coming to adverse neonatal outcome, the ART conceived offsprings, they are at increased risk for lower birth weight, premature delivery, increased perinatal morbidity, and increased hospital admissions than the natural conceived children. The main reason for this is increase in the risk of multiple pregnancies, around 25 to 50% following ART. Single embryo transfer instead of multiple embryo transfers can significantly decrease this multiple birth rates. It can improve the neonatal outcome also. However, they say that even the singletons born after ART, they are also at higher risk, not only the multiple pregnancies. So meta-analysis done in 2005 by Bower and Hansen found that there is twofold increase in the rise of perinatal mortality, low birth weight, and preterm birth, and there is almost 50% increase in the risk of being small for gestational age and 30 to 35% increase in birth defects even for the singletons conceived via ART. So what are the strategies to minimize the risks due to multifetal gestation? One is, we all know hyperstimulation can be like controlled, that is low dose stimulation protocols, close monitoring of the hormonal levels and follicular numbers during superovulation, limiting the transfer to fewer embryos per cycle, elective single embryo transfer, and fetal reduction for higher order multiple pregnancies. So it has been postulated that ART procedures may affect ART offsprings via changing the gene expression in the placenta. So in addition to this, there will be early fetal loss in a multiple gestation. So even there is singleton born later, so if there is history or if there is like early fetal loss in the multiple gestation, that itself can increase the risk for preterm birth for the remaining singleton. And they also say that the number of original fetal hearts observed on ultrasound, this is determinant for the risk of low birth weight. So Dickey et al. Found that pregnancy duration and birth weight, it was inversely related to the initial number of gestational sacs, irrespective of the final birth number. So in addition to the ART, the infertile state of the parents itself, that means whether they conceived with the induced conception or the infertile couple conceived spontaneously or with minimal intervention or with IVF or ICSI, they say that even the infertile state of the couple itself will contribute to the high risk of adverse obstetric outcomes than the interventions what we do. Currently, whether ART will affect the perinatal outcome for twins, it is still controversial. A study found that the risk of premature delivery, low birth weight, and neonatal death, it was lower in twins conceived in ART compared to the naturally conceived twins. So in ART twins, these risks are lower in naturally conceived twins. The present study in 2018, they have told like that. Why? Because in ART, that is, there will be high rate of dizygotic twins, whereas in naturally conceived, it is more of monozygotic. So meta-analysis shows 30 to 40% increase in major malformation rates for infants conceived through ART compared with the naturally conceived children. In recent large studies and meta-analysis, there was no significant differences were found between ICSI and IVF children. So whether we do inject the sperm or it selects sperm, that is IVF, the anomalies or abnormalities, malformations, no significant difference between them. Whether it is ART procedures or the infertility situation that results in the increased risk of birth defects, it still remains in debate. The meta-analysis, this meta-analysis, it reviewed almost 46 studies, including 1,25,000 children almost. The pooled risk of birth defects was around 1.37, and subgroup analysis revealed a relative risk of 1.58 for ICSI and 1.3 for IVF. So there was not much statistical significance. They assessed the risk for each organ system and found significantly increased risk in the following systems. That is, the relative risk was around 2 for the nervous system, 1.7 for the genitourinary, 1.7 for digestive, 1.6 for the circulatory system, 1.5 for the musculoskeletal system, and 1.5 for eye, ear, face, and neck. So major birth defects documented or linked they were linked with the gastrointestinal, followed by cardiovascular, musculoskeletal, septal heart defects, cleft lip, esophageal atresia, and anorectal atresia. So a study by Tarabit et al. Used data from the Paris Registry of Congenital Malformations. It suggested that children born as a result of ART had a higher incidence of congenital heart disease than controls. They were specifically associated with significant increases in the chance of specific malformations like outflow tract, ventricular-arterial connections, cardiac neural crest defects, and of the double outlet right ventricles. So in analysis in 2004 by Rim et al. Reviewed 19 studies. So they found an overall odds ratio of 1.29. In the second meta-analysis in 2009, the adjusted OR was 1.01. They concluded that ART may not increase the risk of birth defects as much as previously reported. So chromosomal abnormalities, a small increase of chromosomal abnormalities, especially in males with severe infertility after ART has been reported. So abnormal karyotype was detected in almost 14% of the azoospermic men and 5% of the oligospermic men. They observed more prenatal abnormalities when spermatozoa derived from men whose sperm concentration was below 20 millions was used for ICSI, prenatal abnormalities. So the epigenetic mechanisms are heritable differences. Coming to the epigenetic disorders, epigenetic mechanisms, they are the heritable differences in gene expression without altering the primary DNA sequence. So epigenetic marks include DNA methylation at CpG dinucleotides, covalent modifications of the histone proteins, and non-coding RNAs and other mechanisms. Two specific types of epigenetic regulation established in the early development include X chromosome inactivation and genomic imprinting. Both genetic and environmental factors impact epigenetic marks, generating the phenotypic variation that ranges from normal variation to human disease. The aberrant epigenetic pattern can lead to a variety of human disorders, including subfertility and imprinting disorders. The epigenetic reprogramming, it takes place at two pivotal developmental stages. One is during the gametogenesis, that is genome-wide demethylation of the primordial germ cells occurs in future gonads. Methylation in primordial germ cells then occurs. Spermatogenesis, it occurs prenatally, so DNA methylation programming is complete by birth. The epigenetic reprogramming of oocytes begins at puberty and is nearly complete at the time of ovulation. So during gametogenesis is one stage and another is during early So in the early embryo, both paternal and maternal genomes become demethylated by 4-cell stage. Remethylation of embryonic genome then occurs. The methylation patterns of imprinted genes, they are not altered during remethylation. So both oocyte and pre-implantation embryonic epigenetic program could potentially be influenced by ART. So animal studies show that they have superovulation is associated with methylation changes in maternal alleles. It also been demonstrated after IVM. The imprinting errors occur after superovulation may have transgenerational effects on the offspring. The culture media used can also affect the birth weight in animals. Whereas in human studies, they examined the methylation differences in CpG sites of more than 700 genes in samples of placenta and cord blood obtained from in vitro and in vivo conceived children. It was found that ART conceived children, they had lower methylation levels in placenta and higher methane levels in cord blood. So several of these abnormally methylated genes, they are known to affect the adipocyte development and differentiation and insulin signaling and obesity. Ovulation induction as well as IVM, they have been shown to induce changes in DNA methylation in humans. Several genes demonstrating aberrant methylation after ART, it's been linked to adipocyte development and differentiation, insulin signaling, and obesity. Some of the cardiometabolic outcomes seen in the ART children, they could be a result of epigenetic modifications induced by the ART procedures. The transgenerational imprinting effect seen in animals could also be possible in humans. So ovulation induction as well as in vitro maturation IVM, it has been shown to induce changes in the DNA methylation in humans. So several genes demonstrating the aberrant methylation after ART has been linked to adipocyte development and differentiation. Some of the cardiometabolic outcomes seen in ART children. 1 minute. My slide only has not changed. Some studies suggest that epigenetic changes may be linked to the diagnosis of infertility itself rather than specific ART processes. It was shown that around in normospermic individuals, around 0% in normospermia, moderate oligozoospermia, it's around 17%, and severe oligozoospermia, it's around 30% for the altered H19 methylation profile. These inherent imprinting errors in male could then be passed to the offspring using ART. So intrinsic imprinting errors associated with the infertility, it has also been demonstrated in women undergoing IVF. So genomic imprinting, most autosomal genes, they are expressed simultaneously from both the alleles. However, in a small subset of genes, one allele is silenced in a parent-specific manner by the process called imprinting. So instead of expressing two alleles, one allele will become silent here. This is called imprinting. So genomic imprinting, it is a process of chemical modification of nucleotides in which only one allele of specific genes is functioning and the other allele is silenced based on the parent of origin. So these imprints provide the potential for monoallelic parent of origin specific expression of the genes. So about 100 human genes have been reported to be imprinted. In humans, imprinted domains have been found on chromosomes 6, 7, 11, 14, 15, and 20. So within these domains, imprinted genes are regulated by the imprinting centers. So mutations or epimutations in the imprinted genes or imprinting centers, they are associated with imprinting disorders. So there are around 9 human imprinting syndromes have been identified. The current evidence linking with the IVF is only for 3 imprinting syndromes, that is Beckwith-Wiedemann syndrome, Angelman syndrome, and more recently maternal hypomethylation syndrome. So coming to the Beckwith-Wiedemann syndrome, 79 sporadic Beckwith-Wiedemann syndrome cases were included in this analysis. So 6 of 79 children born with the syndrome conceived with the use of ART, 1 IVF and 5 were ICSI done patients. So around 3% ART prevalence among the syndrome children was noted, which was significantly higher than 0.8% in the general population. So all cases of these syndromes conceived after ART involve loss of maternal methylation at the KVDMR1 imprint control region on the chromosome 11. So compared to the expected 50% chance of having this molecular alteration. So retrospective case series of 19 children born after ART with the syndrome, 12 of the 19 medical records from the reproductive endocrine centers were successfully obtained. Out of the 12, 10 of them had IVF, but no single consistent culture media was used in this group. So half of the patients, they underwent IVF with ICSI, whereas the other half had routine IVF. One child was conceived through CC and IUI, whereas another patient conceived through gonadotrophins and IUI. The only consistent finding was that all 12 women received some type of ovarian stimulation medication. So ovulation induction basically was done in all these 12 women. So most studies report significantly increased prevalence of ART in these syndromic children. All reports have consistently demonstrated that 90 to 100% of the cases, they had an imprinting aberration, mainly hypomethylation of the maternal allele as the molecular cause in syndrome, this syndrome born after ART. However, this could be due to chance or by bias also. So current evidence suggests that routine screening for this syndrome in these children born after ART is not warranted. It is not required, as overall prevalence for the syndrome in these children is considered too infrequent to justify the screening. Coming to the Angelman syndrome, so studies suggest that subfertile couples had an increased risk of conceiving a child with an imprinting defect causing the Angelman syndrome. So till 2006, there were 7 reported cases of this syndrome after IVF or ICSI, and 5 of them appear to have imprinting defect as the etiology. It remains unclear whether IVF or ICSI or ovulation induction is the cause for this syndrome. So increased risk of cancers following ART. Several studies revealed their risk of epigenetic disorders in ART conceived children. The relationship between the epigenetic disorders and cancer, it has been demonstrated. However, the evidence of cancer risk in children after ART is still very limited. So cancers possibly linked to the ART include retinoblastoma, hepatoblastoma, and ALL. So the study, a Dutch study, in 2002, that is between 1995 and 2002, reported an increased risk of retinoblastoma in children conceived by IVF. But the expanded study, same thing between 2002 and 2007, showed no significantly elevated risk. So a French study in 2012 revealed that retinoblastoma is not associated with ART, but is associated with the infertility situation itself. So there is 9-fold increase in the risk of hepatoblastoma was observed for the patients with reported parental infertility treatment. A report from Greece and Sweden suggests that IVF is associated with increased risk of early onset ALL, that is acute lymphoblastic leukemia in the offsprings. Increased risk of leukemia, it was observed occurring almost 3.8 years earlier in IVF offspring than in the control. So the adverse neurological outcomes were neurological sequelae such as cerebral palsy. They are more frequently seen in ART conceived children compared to the naturally conceived. Multiple pregnancies, premature delivery after multiple embryo transfers, they have been attributed as the causes for this cerebral palsy. There is an increased risk of CP in singleton born after ART also been reported. So in 2006, so there is a meta-analysis performed which included 9 CP children out of 19,462 ART conceived children. They found that children born after IVF, they had an increased risk of CP. Tendency towards increased risk for CP in IVF singletons compared with non-IVF singletons was also noted. So Bay-B1 et al. In 2013, published in 2013, they conducted a systemic review including a total of 80 studies, which included almost 250,000 children. The cognitive, behavioral, emotional, or psychomotor development or diagnosis of the mental disorders, they were measured in this study. They concluded that the neurodevelopment of the children born after fertility treatment is overall comparable to that in children born after spontaneous conception. That means there was no much difference between the two. So it's a Swedish study from 82 to 2007. The adjusted odds ratio for CP after IVF was 1.8. However, when singletons or when unlike twins or unidentical twins were analyzed, odds ratio was not statistically significant. So between 2004 and 7, when the twinning rate after IVF was less than 10%, the odds ratio was 0.97. It's drastically reduced when the twinning rate is less. So they concluded that the moderately increased risk for the cerebral palsy after IVF was most likely a consequence of increased risk of neonatal morbidity associated with multiple births. The risk of cardiometabolic diseases in these children. A few studies report the risk of metabolic syndrome and chronic disease among adults conceived by ART. So in a study, IVF children had higher body fat compared with the controls, and there is increase in systolic and diastolic blood pressure and fasting blood glucose levels. It's almost 8 to 18-year-old IVF group has been reported. There is increase in BP and blood glucose in the IVF group. It persisted after controlling for body size, birth weight, or the cause of subfertility. That means matching these criteria also, the increase in BP and blood glucose in IVF group persisted. So metabolic syndrome may take root during early development throughout the gestation, as stated in Developmental Origins of Health and Disease hypothesis. Epigenetic differences have been hypothesized to be the global mechanism behind these health differences. Placental dysfunction also could be an indicator, and placenta to birth weight ratio has been found to be increased among the ART births. So coming to the physical health, vast majority of the studies, they have not found any differences in the postnatal growth until 12 years of the age. Whereas some studies suggest that ART children are taller, And there is concern also that this increased height might lead to health risks in the future, just as the rapid weight gain during early childhood, that is between 1 to 3 years in IVF children, is related to higher blood pressure levels. So authors examine, that is, the authors examine the height, weight, and health conditions of the children after ART. They found no deficits in growth among children and adolescents conceived by the ART. There was some evidence that children who were conceived by the ART, they have more frequent diagnosis of illness and hospitalizations than children conceived naturally. They say this can be because of the over concern by the parents also, because they are precious children. The gonadal development of the ART conceived children is considered to be normal, as majority had normal testicular and penile size. An increase in urogenital surgeries in ICSI conceived boys because of a significantly increased risk of undescended testicles may be attributed to preterm births also. And boys who are conceived by ICSI may inherit the impaired testicular function of their father. In females, there was no difference in the menarche, genital development, or the pubic hair development, but the breast development was less advanced compared to the naturally conceived children. Another author postulates that reduced weight during the fetal life leads to loss of fat-free tissue, resulting in a larger amount of fat tissues in newborns. This fat tissue tends to develop after catch-up growth, which implies hyperleptinemia and insulin resistance, which influences the time of menarche and may lead to PCOS in these individuals later. So coming to the psychosocial development, data on child behavior after ART overall are reported to be reassuring among infants and children. Studies on ICSI conceived children also show reassuring results. So no significant difference was found between the ICSI and IVF groups for communication, self-dependence, locomotion, work skills, socialization, or the self-management. So Vaishnar et al. Compared children and adolescents aged between 9 and 18 who were born after IVF with those born spontaneously from patients with the fertility problems. So there were trends towards fewer externalizing behaviors and increasing withdrawn behaviors or depressive symptoms in the ART conceived group, as reported by the parents and teachers. In 2011, the same investigators, they reported on the self-reported functioning of the adolescents in the same cohorts. The 11 to 18-year-old participants responded to the youth self-report questionnaire, and the scores were all within the normal range, and no difference was found between the IVF and the control groups. So studies about the relationship of ART and autism spectrum disorders have shown inconsistent results. So population-based study in Denmark found no significant increased risk of ASD in ART conceived children. However, another large study from Israel showed that the rate of ART in almost 500 children with ASD was significantly higher than that in a large Israel population. So that's a large, well-designed prospective study to assess the rate of ASD in newborns conceived of ART. It's needed. So outcomes in children born after ICSI and TESE. So matched cohort studies have showed similar neonatal outcomes for IVF and ICSI children and for TESE and ICSI children, including singletons. Overall, the risk of major congenital malformations was slightly higher with the ICSI. The odds ratio is 1.3 versus the general population. So Feder and et al. Explored whether neonatal outcomes, including congenital malformations in children born after ICSI with the epididymal or testicular sperm, differ from the neonatal outcomes in children born after ICSI with the ejaculated sperm, IVF and natural conception. The children born after ICSI with epididymal and testicular sperm, they had same total malformation rates as have children born after ICSI and IVF with the ejaculated sperms. That is, there is no difference between the surgical methods and the ejaculated sperm methods. So outcomes in children born after cryopreservation. So the literature review suggested that pregnancies and infants conceived following slow freezing of the embryos are not associated with the increased risk of adverse obstetric or perinatal outcomes. In 3 small studies, including children from natural conception as controls, there was no difference found in the neonatal outcome or congenital malformation rate. The major malformations were more frequent, but however, the major malformations, they were more frequent in cryo-ICSI liveborns than in cryo-IVF liveborns and fresh ICSI liveborns. So subsequently, results from Australian registry showed a lower number of birth defects following ICSI with frozen embryo cycles compared with the fresh cycles. Lower number of birth defects. So recent systematic review and meta-analysis of 11 studies comparing obstetric and perinatal complications after cryopreserve versus fresh embryo transfer, they concluded that pregnancies arising from the use of cryopreserved embryos have better outcomes. Possible explanation can be only the healthiest embryos will survive the freeze-thaw process. So effect of blastocyst culture. So a systematic review and meta-analysis has demonstrated that probability of live birth after fresh IVF is 40% higher after the blastocyst stage embryo transfer compared with the cleavage stage embryo transfer when equal number of embryos are transferred. The risk of preterm birth among singletons was significantly greater after blastocyst stage transfer than after the cleavage stage transfer. So the odds of any congenital malformation versus population figures was 50% higher after blastocyst transfer, whereas after cleavage stage, it was only 11%. These differences, it's attributable to increase in monozygotic twinning in blastocyst cases. So the 6 observational studies of low to moderate risk of bias were included. There was a significant increase in preterm birth, cleavage stage and blastocyst stage embryos and congenital anomalies also. There was no difference in odds of preterm birth, low birth weight and very low birth weight. So prolonged in vitro culture may adversely affect subsequent fetal or placental development. Future risk reduction strategies may include improvement of non-invasive cleavage stage embryo selection and improvements of prolonged in vitro culture system safety. So outcomes in children born after IVM. So like thousands of babies have been born to the present situation worldwide following IVM, but formal prospective pediatric follow-up studies, they are limited. However, similar obstetrical outcome and congenital anomaly rates have been documented following IVM, IVF and ICSI. So neurological development of IVM children at 2 years of age also appears to be normal, although the conclusion is based on only like small group of children. So effect of PGD or PGS, that is doing biopsy on the embryos, whether it will affect the offspring, any anomalies observed, because we are doing invasive procedure. The overall prospective for children after PGD PGS appears in line with the standard ICSI. However, it has been associated with a substantial increased risk of perinatal death compared with the standard ICSI. The perinatal death rates among the biopsy done PGD PGS singleton and ICSI singleton children was similar, 1 versus 1.3. So no difference. But there is significantly more perinatal death seen post PGD PGS multiple pregnancies compared with the conventional ICSI multiple pregnancies. That is 11.7 versus 2.5. The effect of assisted hatching. We are nowadays doing assisted hatching like laser assisted hatching, all those things, whether this will affect the offspring. The assisted hatching has recently been shown to enhance the clinical pregnancy rates, but not the live birth rates. And it doesn't even reduce the multiple pregnancy rates. So the long-term impact on the pregnancy and offspring is, however, unknown. So this we have summarized into a table. I mean, based on this RCOG and the ACOG. Thank you. Any doubts?
Dear doctors, any doubts?
Madam, I have a
Yes.
doubt, ma'am. Ma'am, according to the study, blastocyst transfer has more congenital anomalies, ma'am.
That's what, yes. Because they say maybe because of more culture, like in vitro culture.
Okay, ma'am.
Compared to the cleavage stage, blastocyst has more. That is what they think. Finally, the overall, what is this? What the entire class says is that the ovulation, it's ovulation induction or the IVF or ICSI doesn't mean the infertile couple, whether they conceive naturally or whether they conceive with the ovulation induction or interventions, they have higher risk for anomalies and abnormalities than the spontaneously naturally conceived people without the history of infertility. That's what the entire finally.
Ma'am, what is the risk means what we have to tell, ma'am, in the exam? If they ask what is the risk of people who have conceived by IVF means,
Huh.
what is the percentage of risk means what we have to tell, ma'am?
We have to tell it is definitely higher than the normal people.
Natural conception.
Yeah, normal people. But infertile people conceive naturally also have higher risk. And it is comparable with the IVF or ICSI.
Okay, ma'am. And blastocyst transfer has more.
That is what these reviews are showing. Blastocyst has relatively more. And even the PGD, PGS has also relatively more perinatal deaths.
Okay.
Ma'am, what is the reason after PGS for increased perinatal deaths?
Maybe intervention only. Other than that, nothing specifically they have mentioned any reason.
So, ma'am, do we share this information when we are offering PGS to patients?
We will only, no, because we don't actually. We'll only tell that it might improve the pregnancy rates, but still, see, 100% not sure, no, that even PGD, PGS, normal embryo, that is euploid embryos also can result in anomalies also, even after PGD, PGS. Practically, we don't tell.
Ma'am, should we hand over these details to the patient? Ma'am, should you put it in their file so that that means they have read it and they have gone through, after that they have taken a decision?
Now, see, we are taking only from the outer layer. We are not taking from the inner cell mass actually.
But
Right.
even then, it is studied that there is high perinatal
Better to put a word, because in future, if something goes wrong, they should
it is for future,
at least, they should be aware.
Do
Ma'am,
we,
are you routinely offering PGS to females who are, say, 40 years of age?
No, we are not. Only for the recurrent implantation failures or RPL or documented only, like usual causes. Because the 40-year-old, how many embryos, as such, for getting the number of embryos also will be less for them.
Ma'am, I have a doubt, but not related to this. I have a doubt, ma'am. Ma'am, on what basis you infertility specialist will decide that she will transfer on day 2nd, on day 5th, depending on certain conditions, or any protocol is there, ma'am, for that also?
Nothing, actually institute protocols only. See, in Garbhagri, usually freeze all and day 3 transfers only. But if day 3 transfer fails, then they will consider, if enough embryos are there, they're considering sequential transfer than direct also. If enough like good quality embryos are there, then we can go for direct blastocyst also.
Okay, ma'am.
There is nothing like that.
Okay, ma'am.
We all know that blastocyst transfer gives good results.
Okay. Ma'am, comparatively frozen embryo transfers and fresh embryo transfers, what will be the difference, ma'am? Like on what criteria, ma'am?
See, fresh embryo, here what we follow is fresh embryo transfers only when the E2 levels are low and number of embryos what we get are also low
Okay.
and the quality is also little compromised, embryo quality.
Okay,
Then
ma'am.
think of transferring fresh embryo transfer.
Okay,
Otherwise,
ma'am.
if the embryo, because they should sustain the freeze thaw process also, no?
Yes, ma'am.
Otherwise, we will mostly freeze all is the rule. Only in certain conditions like this, what I mentioned.
Okay, ma'am. Thank you, ma'am.
The E2 level and number of eggs that we decide that we have to go for fresh.
Yeah, even if the patient, see, finally only 2 embryos are there, still we freeze if the embryo quality is good. If the embryo quality is compromised, then we will always transfer fresh, because we say no, we decide, we'll think no, that this is not going to, these embryos may not sustain the freeze thaw process, then we will transfer, decide to transfer in the fresh cycle itself.